So hello and welcome to iTenif Healthcare Solutions webinar. We're excited to share our NextGen PM we're excited to share our webinar, NextGen PM as a decision support tool, using your data to make sound business decisions. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for iTenif. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that the webinar will be recorded. We're going to send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with iTenif, I wanted to share a bit of who we are with you. We've been specializing in next-gen healthcare. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. Basically, we do everything next-gen, and we also have two next-gen add-on productivity solutions, ChartGuard and Refund Manager. Next, I wanted to mention some upcoming webinars that we have. ChartGuard for NextGen, your downtime solution, is going to be tomorrow, June 29th at 12 o'clock noon Central Time. ChartGuard enables you to view, print, or electronically access your patients and your practice appointment books, even if your EHR system fails or your network is down. We're going to be showing a demo of that tomorrow. If you haven't seen it before, check it out. And you can register for that on our website in the Events and Education panel. Okay, so back to our webinar on NextGen PM as a decision support tool. At the end of the presentation, we're going to open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will be muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. So without further delay, I'd like to introduce our presenter for today. Dottie Pinnock is Managing Consultant at iTenif. Dottie is a true NextGen PM expert, and we're eager to learn from all of her experience. So Dottie, I'm going to go ahead and pass the webinar off to you. Please feel free to get started when you're ready.
Hi, everyone. As Chelsea said, I'm Dottie Pinnock, and today what we're going to talk about is using NextGen PM as a decision support tool and how to get the data out of NextGen to help you make sound business decisions. Our webinar today is going to be broken up into 4 parts. Basically, looking at the patient population, using it for some marketing purposes and evaluation, looking at patient appointments and what we can learn from our patient appointments, reviewing encounter data, what can that tell us, and lastly, critical financial data that we need in terms of making decisions about our practice. So first, let's start with evaluating our patient population. Growing your practice starts with a full understanding of your existing patient population, and I've kind of broken it down into 3 things that I most commonly help clients with. Determining the total number of patients in your practice, looking at the demographic breakdown of that population, and then a good way to determine how your practice is growing in terms of the new patients being added. So first, the first thing I want to talk about is creating a list of unduplicated patients seen within your practice during a specific time period. And the best tool to use for this is the service item summary. There are several reasons for that. One, the service item summary is a monthly report. What a monthly report will do for you is collapse the data to the lowest common denominator. And that's really critical when we're trying to get to that magic unduplicated number. The other thing it does for us is it gives us the ability to limit our report to a certain time period. So if I want to know how many patients are in my population within a certain, that I've seen within my patient population within a year, a month, a quarter, that using filter 1 to restrict that data allows me to return only results for patients seen within that time frame. And again, because it collapses data to the lowest common denominator, that's how I'm going to get to that unduplicated number. So let me show you what I mean. If on my report, the only column I use is the person number, or you could use the patient name. I'm very sensitive when working with clients and with even when having clients run reports of exposing PHI. So you'll see that I often use the person number in lieu of the patient name, unless I just really need to know the name of the patient in this report. So what I've done is I've just simply said, the only column on my report is the person number. And then using the totals tab, I asked the system to count for me the number of persons in my database for that time period. So that's going to give me a result of 292 unduplicated patients within the time period I selected. Now, if I want to know a little bit more information about those patients, I could add their age, I could add their zip code. There's a lot of other data columns in there that would not cause that data to duplicate. In this example, maybe I want to sort it by age and see if I have more older patients or more younger patients in my population. Or maybe if age is what I really care about, and again, the nice thing about NextGen is that it lends itself to customization for all your specific needs. If I'm a pediatrician or a family practice, family practitioner, I may be very interested in understanding the age composition of my practice, because as my practice ages, that may be what I want to happen, or I may want to focus my marketing efforts on making sure that I've got younger patients in my practice. So another way I could use the same tool is to simply group it by age. Now again, I've shown you what I did here in the Totals tab. To make the report make sense to me, I changed the subtotal prefix to be exactly what I was grouping it by, which is the patient age. So, and then I totaled my person numbers so I know how many people I have in that age. So my results will show here that for 4-year-olds, I have 3 in my practice. 6-year-olds, there are 1, etc. So this report will tell me age by age exactly how many people I have in that population. And if age is not what you care about, maybe it's zip code or some other demographic piece of information, like maybe primary care provider or referring provider. There are many other things that you can include in this report depending on your specific needs. Another option that you could consider is unduplicated patients by provider. Now, if I take the same exact report that I used with just the person number that I was adding up, and I add the rendering provider, now it's going to give me how many unduplicated patients were seen for each rendering. One thing to note is, if you notice back when I was doing this unduplicated this way, my result was 292. So for the time period I'm evaluating, there are a total of 292 distinctly different people in that time period that had encounters. But if I group it by provider, you'll see that same number increases. And what that tells me is, because it's the lowest common denominator, for example, if Dottie Pinnock has been seen by more than one provider, it will add her again once for each of the unique providers that she sees. So just actually seeing that number 292 against the 441 tells me I have several patients in my practice that see more than one provider. And that might be data that's relevant within itself. Are your patients only seeing one provider in your practice, or do you have a large overlap of patients that see multiple providers? Another thing to think about is by location. I know when I managed practices many years ago, one of my biggest challenges as a manager was parking. You always want to make sure you've got enough patient parking. So it sometimes is important to see the number of unduplicated patients by location. Or maybe you're considering closing one of those locations or expanding one of those locations. This is a good way to look at the number of unduplicated patients being seen in each location. The same with the providers. If I take that number 357 and I compare it to my original number 292, there are not a lot of patients that are seen in more than one location. And that's kind of interesting in and of itself. Do your patients, are they only seen in one location, or are they seen in multiple locations? And that's the kind of information that these reports can help you discern. Another thing that we always have to think about when we're talking about reports of any kind is financial class. So of that 292 patients, how do they break down in financial class? Now, I could always add dollars and cents to these reports, so I could always add the charges and associated transactions. For my purpose, though, I was really just looking at the patient population and the distribution across doctors, across locations, and now across financial classes. And I can see from this number that I probably had maybe less than 20 patients who were seen under more than one financial class. Another thing that you could do with using the same exact report but to get different data, because in our ever-changing climate, we're always trying to get the data that we need to make decisions. So maybe you've got a specific service, a specific CPT code, or a specific type of service like radiology or EKG, and you need to make some decisions about that. How many actual patients are using those services? Maybe you want to make a change in that service. You could use that report and limit it by either department or by CPT code to determine how many unduplicated patients are receiving those services. The other thing in your patient population that I've helped many clients with is trying to determine how many new patients were added to your practice. Using CPT codes alone is kind of tricky, because you can say, well, just give me the 99201s through the 99205s, or the preventative new patient codes, or the the ophthalmology new patient code. So you could conceivably do it by CPT code, but depending upon your specialty, you may have new patients introduced into your practice via the emergency room or consults that you pick up in the hospital. So there may be other ways that patients are entering your practice. And it also might be that even though that patient was a new patient to one doctor, maybe they're that same person is an established patient with another doctor. So that can be kind of tricky. And because of that, what I typically use is the chart summary. So I will run a chart summary report, and a lot of times I'll add other data because I'm looking at the new patients added to my population. Maybe I want to know their age, gender, zip code, primary care provider, or some other data element that would help you. Some of you use marketing plans, so if you're using marketing plans, maybe you want to evaluate it by marketing plan as well. But as you can see here, the patient chart demographics report has a filter 1 option, which is going to allow me to customize the date, the create date of the chart. So this is a really good way to see how many new charts were created during that time. And for most people, although I understand not everybody does things exactly the same way, but for most practices, adding a chart would be adding a person to your practice. So in my example, I've just looked at a time period that I wanted to evaluate, and I've looked at all the patients that were added to my practice during that time period, how old they were, their gender, what zip code they came from, and who their primary care provider is. The next section that I want to talk about are patient appointments, because I've given you tools to help you evaluate your total patient population, but a lot of times appointments play a pretty big role in getting people into your practice. So we're going to kind of take a top-down look. Statistical analysis of appointments is a great way to give you a snapshot of your appointment life. It's going to be sort of a top-down view. Now, a lot of times you'll have to make certain adjustments to make sure you eliminate things that aren't really tied to patients. So a lot of clients will go into the events filter and filter out things like meetings or blocks or resource schedules that aren't really used for real patients. But once that stuff is eliminated, the statistical analysis can be run by resource, by location, on a day-by-day basis to see how many patients were scheduled, kept, canceled, and no-show. Now, again, this is my test database, so I apologize that the data on this report doesn't look very real, but it does kind of give you an idea of what's possible. So on a day-by-day basis, I can see how many patients were scheduled to come in that day. And this is going to give me an idea of if I have a no-show problem, if I have a cancellation problem, and sort of a snapshot of my appointments. If I want to look more in depth, let's say I realize that I have a very high no-show rate, then a more in-depth analysis can be done by the appointment listing report. So using the totals tab, so again, there's a couple of little tricks with NextGen, and one of them I'm going to show you now. A lot of times, if you're trying to run an appointment report and you just want to look at totals only, you won't have the option to get that total lines only. And the reason you don't have that option, you see how it's grayed out here in my totals tab, is because naturally out of the box, the appointment report doesn't sum up anything or count anything. So if you want to use this appointment report to do some analysis, you have to put a green check in one of the columns, which you'll notice will make that total lines only box open up and allow you to actually do some comparative analysis. So what I want to count here is the person number. I want to look at, again, like I said, I try not to use patient names for HIPAA disclosure purposes, so I just want to count the person numbers. And then I'll show you some ways that we can use that data. So what I've done here is it allows me to look at each provider grouped by event. So for the time period that I selected in filter 1, I could see how many patients are on the schedule based on the options I have in filter 1, either kept, canceled, no-show, or a combination for each event. If I change my sorting order, in other words, I sort it first by event, then by provider, I can do a comparative analysis on how many office visits are being assigned to each provider. One of the things I used this for when I managed a practice was to evaluate the distribution of new patients. So I would limit my analysis to new patients, events that were for new patients, and then I would try to count the person numbers by provider to ensure that my new patients were being distributed in accordance to the way the providers had asked. The other thing that isn't always immediately apparent but can be very useful in filter 1 of the appointment analysis, you can use the create date instead of the appointment date. Most of the time when we run an appointment listing, it's to find out who's coming in for the day, so it would be on the actual date of the appointment. But if I change that logic to create date instead of appointment date, it's going to allow me to pick appointments that were created on that day. And this is a really good day from a really good way from an analysis standpoint to see who created the appointment and what kind of events are being created. So back to my new patient analysis, let's say I want to, let's say my the decision I'm trying to make is the front desk adequately parsing out the new patients by resource correctly or the way they've been asked to do. I could look at the create date, how many new patients come in, new patient appointments are scheduled in that month, or the creator, who is scheduling those appointments, and the employee productivity from the appointment staff productivity. The next thing I want to talk about is reviewing data by patient encounter. So that's, I told you there were 4. This is the third one. And when I talk about reviewing encounter data, there are a couple different ways to do this. I like to use the service item summary for a couple of reasons. One, it ties the transactions back to the charges. So as we talked about, it also collapses to the lowest common denominator, which it does, which is the way we did the unduplicated patients. But the other thing it does is ties the associated transactions back to the charges. So if the charge date is set in filter 1 and the transaction date is left blank, it will return all of the payments and adjustments and refunds for those specific charges. And that's really good information. The other thing that I like about this report, and it's not very commonly known, I haven't had a lot of clients who've really capitalized on this, but there were some new options added somewhere around 5.8 to allow you to compare months. So you can compare years and months. And that's something that can be very powerful when you're trying to evaluate or make decisions about your practice. And I'll show you some examples. So in this example, what I was trying to accomplish is to figure out how many encounters I had every single month in my database for the past time period. Excuse me. And as you can see here, what I've done is I've used the month-year column. I've counted the encounters. I've included the charges and the associated payments and adjustments. So now, month by month, I can see for whatever time period I've selected, I sort of picked a random time period, I can see how many encounters were generated in my practice. I can obviously break this down further by rendering, by financial class, by location, the same as any of the other options available on this report. Another thing I can do is I can compare months by provider. So like I said, I've taken my month-year column, I've grouped it by that, and then I've grouped it by rendering provider so that I can see comparatively for each month how the providers are doing in terms of how many encounters they're generating. Same as location. I've taken it month by month to see what the distribution of the encounters are by location. And financial class, just like with the unduplicated patients, these are things that a lot of people want to know. Are they, and again, depending upon your geography, it may be something that if you think that you see a lot of snowbirds, or if that you have an increase or a decrease in the winter months of Medicare patients, this might be something that would help you plan. So I'm trying to show you how to get the data, But in terms of how you would use it, that month-by-month comparison could potentially help you understand the fluctuations and anticipate the staffing changes. So now let's look at it by month, by year, and that's the sort of the way that you could look at trends. So using the separate columns of month and year on this report, now I can say, let's look at the month of January and how has that trended over the past several years. And again, I apologize because this is my laptop database, so the data isn't as meaningful as it would be in your practice. But I can see, are my volumes consistent in January year to year, or have my volumes fallen for January year over year? And again, that's the service item summary. Using this report, the service item summary is going to take these charges, their associated payments and adjustments. So these are the payments that were for these charges. Conversely, if I want to look at this a little bit differently, I can use the monthly transaction summary. The monthly transaction summary also has those month, year, and month, year columns, which will allow me to sort the data in a way that I can do comparative analysis, the same as the service item summary. The difference in the monthly transaction summary report is that it shows charges and processed transactions for that period. So let me try to see if I can explain that a little bit. If I look at this report in January of 2014, there were 50 encounters, 115 charges, $12,000 in charges. During that same month, 166 adjustments were made. Now, those adjustments in the amount of $2,721.12 did not necessarily happen against that $12,000 worth of charges. That $2,000 in adjustments were the total adjustments made during that time period. They could have been on charges for any time period, but they were actually processed during that time period, and the same with the payments. So this gives me the same charge information, but different transaction information. Additionally, the service item summary can tie financial information and encounter information back to appointment events. One of the cool things that was added, and again, I think this was added somewhere around 5.8, is that the service item summary allows you to not only count the encounters, look at the charges and the financial data, but to tie those charges back to the actual event that was scheduled. So I can see how many encounters were scheduled. For example, for my 6-month follow-up, there were 4 for $399. That number across the top, I kind of wanted to stop on that for a second. It's unknown, and in NextGen, when you get an unknown value, it's because whatever you're grouping it by does not exist. So in this example, because I'm grouping it by appointment event, that unknown number is the number of encounters that were created that are not associated with an appointment. So those would be like hospital or nursing home or other encounters that were created in your database that were not associated with a specific appointment. So when an appointment is checked in, it associates the encounter. And that's how it allows me to count how many encounters were actually created for each of my events and how many charges those generated. And I'm not sure if any of you watched the webinar that we had last time, but I explained in that one pretty detailed how to do averages. So it would be very interesting and very easy to do average charges per appointment event using this report. So any combination of the data that I've given you by the appointment type, by month, by event, so you can see if there's a fluctuation by month in your new patients, by provider, by event, by financial class. Really, there are no real limitations here. The possibilities in how you review this data are pretty limitless. I mean, you can slice and dice this once you've got the main tools to help you get the information you need to make any kind of decision. The last piece that I want to talk about may be the most important piece. I think some of the other things we've just talked about will be pretty useful, but this last piece that I wanted to save plenty of time for is the financial piece, because when people think of the NextGen reporting engine, a lot of times they do use it for financial data. There are basically three main ways that we review accounts receivable. So when I think of financial data, one of the first things I think about is our accounts receivable balances. NextGen, I guess the good news about NextGen is there are many options, but the bad news about NextGen is there sure are a lot of options. So what I'm going to try to do is narrow down for you three main options on how to look at your financial data, your accounts receivable data. And the first one is the balance by the primary payer. Now, I know some of you use primary payer in terms of your accounting. Some of you use a different methodology, but it's really important to track things back to that primary payer. So the first thing I want to talk about is the receivable analysis by month. And that's going to provide you with an overview of your financial performance. So the primary payer always is used for the charges. The transaction data actually is pulled from the actual payer, and it, like the service item summary, it ties all transactions back to the charges. The other really nice thing about this receivable analysis is that it separates your active AR from your bad debt AR. So you don't have to do a separate calculation. It's going to show you what's in active AR that should balance to your normal AR reports that you work, and it'll also show you what's out there in bad debt AR. Here's an example of that receivable analysis by month straight out of the box. So if you just go to reports, accounts receivable, receivable analysis by month, that's going to take you right straight to this report. Excuse me. What it gives me is a month by month for the past several months of my charges, associated third-party payments, associated patient payments, third-party adjustments, patient adjustments, refunds, etc. And so if I look at this, I just want to make sure you're clear at what you're looking at here. If I look at the month to date, May, my charges were $19,877. Against that $19,000, I have insurance payments of $500, patient payments of $412, etc. So these transactions that are listed across are specifically for that $19,000 in charges. So what I'm left with at the net is, of those $19,000 of charges that were added in May, what's still out on my AR is $17,000, and you can take that all the way down the line. So for example, in March of 2016, there were $2,400 in charges, and all that's left of that $2,401 in charges is $228.79, because all of those other transactions cleared the balances except for that remaining 228. And then likewise for my bad debt AR. These are the charges that are in bad debt, and these are the associated transactions that you've got so far, leaving you with your current bad debt balance. This report will balance to your monthly changes in AR report, and because it calculates your active AR and your bad debt AR. Another way you can do this, and I didn't include a screenshot, but I do want to stop and show you, is you could also add by rendering on here. So if I add by rendering, I can see month to month what that rendering is doing, or I can add by location if I need to break this down a little bit further and get a little bit more information. That report also comes in a couple of other variations, but the one I use absolutely the most is that by month analysis, because it gives me a really clean look at what's remaining for each month and how the breakdown of my third party versus patient transactions. The second thing I want to talk about is an aging analysis by encounter. And that's going to give me a very different way to view my receivables. Again, we talked about that primary payer. This is going to track everything back to the primary payer on the encounter. It's going to display my aged balances so I can truly look at my aged AR. But the other reason I often use this report is because it's going to count the total encounters with open balances. So let me show you an example. What I've done here is using my totals tab, I've asked it to count the open encounters so that E/I encounter, invoice, account, budget, that 405 is actually the number of open encounters in my database. And then obviously my aged AR, which you're used to looking at in that way. But sometimes it's really important from a staffing perspective to know how many total encounters are out there with open balances. Because depending upon how you break up your AR, especially if you break it up by primary payer, this is going to give you some insight into what that distribution would look like. The insurance aging analysis is the opposite way to view the data. So in other words, it's going to track financial activity to the current responsible payer of that line item. So unlike the report we just looked at, which was the aging analysis by encounter, this is going to track activity by line item. So you can't use it to count the encounters because if I look at the current responsible payer, it has to go all the way down to the line item. And the reason they do that is because in theory, one encounter could have one balance that's still outstanding to the insurance for one line item. Maybe they appealed that, you had to appeal that and they didn't adjudicate it. And other line items that were outstanding to a different payer. Another nice thing about the insurance aging analysis is that you can use the COB option to display where the balance is. So not only does it track it to the current responsible payer, but it tracks it and it will tell me the position of that current responsible payer. Is that payer primary, secondary, or tertiary? So what I mean by that, just to try and clarify it just a little, if I have a patient with Medicare and Blue Cross, and Medicare has already paid their $80, the current balance is outstanding with Blue Cross, that $20 would report in the insurance aging analysis under the Blue Cross financial class or payer. But it would also report in the COB position of 2, so that I could tell the difference between how much is outstanding in Blue Cross Primary and how much is outstanding in Blue Cross Secondary. And I'm going to give you an example of how I've done that. So in this example, I've used the columns of my financial class, and my second column that I grouped by was the COB. And that COB, as you can see, is going to split it out for me. It's going to show me how much of my Blue Cross my $12,467 Blue Cross AR is out to primary and how much is out to secondary. And it does this for all of them. Now, if I want to eliminate the patient, I can use filter 2, just get insurance balances, because in this example, I was only looking at my insurance balances. So I could use filter 2 to say COB is not equal to P. I also excluded unapplieds because they sort of muddy up the report. And I truly wanted to look at just my outstanding insurance balances and how much of them were primary and how much of them were secondary. If I changed my grouping and I made the COB the first group, then I could easily see how much of my total AR was outstanding to primary, secondary, tertiary. And the last one that I want to cover is the account summary. So the account summary allows you to look at outstanding balances at the account level. So this is going to roll all the way up to the account level. And what I've done here is I wanted to find out how many patients in my practice have an outstanding balance. So in other words, kind of about how many statements I would send if I were sending statements to everyone with a balance, or if I have people assigned to work patient balances, exactly what quantity of accounts would they be looking at. And the way I've done this is I used filter 2 to limit my report to account balances that are not equal 0. So if they have a 0 balance, I really don't want to look at them. I only want to look at open accounts in my practice. And I did that by totaling the account ID numbers and then breaking down sort of the COB distribution to see exactly what was outstanding from insurances and patients. The last thing I want to cover is financial profitability. So one of the things, I know I keep going back to the service item summary. I can't really tell you what a powerful tool it is once you fully understand the logic of how this report works. And the nice thing is that it can provide very detailed or very summarized information about not only the charges, but how much you got paid against those charges. So in my example, what I'm trying to do is I'm trying to determine how profitable my lab department is. So I know from my general ledger costs me to run the lab. I know what my lab, assuming I have a general ledger account set up to track the cost of the lab. And you can do this with X-ray or any other type of service that you specifically want to evaluate. But I've got the expense side with my general ledger, and now I need to look at the profitability side from NextGen. So in my example, I set the filter up to review the lab department. If I don't have a lab, if I'm not using departments, I can use the service item filter to limit that as well. So what I've done here is I've taken the department tab and I've tied just the lab codes. and then I've asked it to group it by department and then use the charge count in descending order that tells me my most common services in the lab. So this is going to give me my highest volume labs and their associated charges and payments. So I put my unit price on here because I thought it would be interesting to see what I charge for each of these. And again, this is my test database, so please, the data is not particularly the issue. It's the structure of how you can run the report that's most important. But this shows me the charge for each of these labs, my total charge amount, and what I actually got paid during the time period that I'm evaluating. So if I've got a general ledger to compare this to, I can see how much I'm spending to run the lab department and how much I'm receiving in revenue. A lot of times I'll run this by financial class because that's kind of, that can be kind of telling as well. How much of it is Medicare lab, how much of it is Blue Cross lab. But again, it really, almost everyone has to tailor the question to your unique practice, because we're very aware of the fact that all of you have very different business models, business needs, and what I've tried my best to do is to give you some examples of things that you could take and adapt to your unique situations. So, in summary, the NextGen reporting engine is very, very powerful. I've just given you sort of a scratch the surface and hopefully just sort of jumpstart your creative juices a little bit to see if I could get you to thinking about different ways that you could use it to make decisions. Everything from marketing, by looking at your patient population, to counting up your encounters, and all the way down to the financial side to let you really understand what's going on in your practice. So
Great, thank you. Oh yeah, no, sorry, Dottie, didn't mean to cut you off there.
Okay, go ahead.
I was just going to say that if you're uncertain of where your practice stands, let I-10 help. We'd be happy to assess you or to help you in assessing your current readiness, providing recommendations, and we also do implementation and processes and procedures. We also have some 3-tiered fixed price MACRA support packages. If you're remotely involved in the MACRA process, you know that it can be quite overwhelming. We have experts that we can come in and help you out from as little to as much as you need with help and support with that. So let us know, and we'd be happy to chat about that. And finally, next steps, visit us at itenv.com. You've obviously done that if you've registered for a webinar. Sign up for a blog and other informative webinars we have going. And also know that we have 3-day fixed site on-site consultations that we can help you with stuff like this that Dottie just did her whole presentation on, PM side of things, EHR side of things. Basically, we'll send out our managing consultant to your practice 3 days on site to really see how you do what you do and follow your people as they do it. And then we'll finish it all with giving you some recommendations and best practices to help your practice be at its best. So let us know if you'd like any information for any of that. Really, we're here to help. That's why we do what we do and why we're in the business that we are. So let us know what we can do to help your practice. And you know, even if it's just chatting to see where you feel that you're at right now, we'd be happy to do any of that. So going on to the questions, again, you can type your questions in the webinar control panel of the GoToWebinar app that you're using to watch this right now, and we're just going to go through them in the order that we received them. We only have a couple, so if you have them, don't hesitate to ask because we're going to be able to answer them all. So first question, is there a report that you can create by a patient to see how many EM services each patient had in a certain time frame? We're trying to see who was seen 2 years ago and if they had any EM visits since. We are looking for lost patients that might have fallen through the cracks.
That's a really good question. So one thing in it, the short answer to your question is yes. You can run a report. The service item summary would be the perfect report to do by patient and limit the service items to your E&M code. So what you would do is you would limit the columns would be the patient and the E&M code and the service item. And the filter service items would just be your E&M codes. And if you group it by patient, it will show you patient by patient how many E&M codes each patient has had within that time period. Looking for patients who've fallen through the cracks is that may not be the best way to do that, because remember, the service item summary only counts what was actually done. So if you're looking for something that wasn't done, that's probably not going to help you. You can use the chart demographics to see patients who have not been seen in a time period, but I'm not sure. I hope I've answered your question. If I didn't, feel free to re-ask it, and I'll try to give you some more specifics.
Great, thank you, Dottie. Next question. Can you run the reports by payer as well as financial class?
You can, absolutely. All of, in my examples, I used financial class because it's such a more manageable list typically, although not in all practices, but for most practices, a list of payers is a pretty long list, and so either payer subgrouping or financial class is more commonly used.
Great, thank you for that. What are the differences between the different MACRA packages? Great question. I'm going to send you some information on it after this. I think it'll just be easier for you to see it all laid out rather than trying to verbally explain it all. So it looks like this might be the last question. What other reports can be run by month or year?
The monthly changes in AR report also has those same month, year, and month-year options as the service item summary and the monthly service item summary and the monthly transaction summary. So there are basically 3 reports that do that. Those aging analysis reports can do that to some degree, but they don't have the same power and capacity for comparative analysis as the monthly changes in AR, the monthly service item, and the monthly transaction summaries.
Great, thank you, Dottie. Do you support compatibility with other population health reporting tools? We do with a couple of them. I'd have to know which one you're specifically looking for, but we definitely do with a couple. I know evolution and management. I think I guess it really depends on what you're looking or what you're referring to as tools. Again, totally open to it. Probably depends on it. Let's talk and figure out what individually you're looking for and what you're trying to work with and figure out, and we'll see what we can do to help. And NextGen population health, of course we do, if that's what you're referring to as well. So it looks like that's it. All the information, the contact information was up on the screen. We will be sending out slides and recordings to this webinar within the next couple of days. If you think of any questions in the meantime, feel free to reach out to Dottie or to me. I'll be sending out the email with the link to the slides. We'd be happy, feel free to reply to that email. And really, we're looking to help you. So feel free to ask any questions, and we're here to help. And thank you all for joining us today. Dottie, thank you for putting this amazing webinar together. And I hope that everybody has a great week.